Hi, hello. Welcome back to the Oncobuddy podcast, your go-to source for cancer care. I'm your host, Miss Gayatri from 4Base Care. Today, we'll be talking about genetic counseling. It is one of the most emerging field in today's world, and we will be diving deep into the world of genetic counseling. Who should consider genetic counseling and how genetic counseling is important in cancer? Joining us today is Vaishnavi S., Junior Genetic Counselor at 4Base Care.
Thank you, Gayatri, for having me join you in today's episode of the Oncobuddy podcast. I am looking forward to enlightening our audience about genetic counseling with you today.
So, Vaishnavi, how would you explain what genetic counseling is?
So, genetic counseling is basically an interaction between a healthcare professional trained in genetics and an individual or family at a risk of genetic conditions. During this session, the genetic counselor generally collects the family history, medical history, and other details to understand if there is any underlying genetic condition. And based on that information that is collected, the genetic counselor suggests suitable tests, and once the results are out, the genetic counselor explains the test results and the future aspects of the family. And these genetic counseling setups could be either cancer genetic counseling, prenatal genetic counseling, pediatric genetic counseling, or even adult genetic counseling. Anything suggested or informed during a genetic counseling session is not forced upon the patients. The counselors lay down all the information which will help the patients to make a decision based on that.
So, you mean the final decision is always to be made by the patient? Would you not advise them like doctors do?
Yes, the final decision is always made by the patient. Genetic counseling is an indirect process where we counselors explain all the pros and cons and options available to the patient and empower them to make a decision for themselves.
That's interesting. So, can you take us through the educational journey to become a genetic counselor?
So, as mentioned earlier, a genetic counselor is a medical professional who is trained in medical genetics and counseling. A genetic counselor should be someone who has deep understanding about genetic conditions and should know how to communicate with the patients and their family members in a way that any person who does not know anything at all scientific should understand. In India as well as abroad, there are master's programs available specializing in genetic counseling. There are also postgraduate diploma certification courses which can be done after the master's degree in life sciences or associated fields.
Can you elaborate on the process of genetic counseling?
Generally, an individual or family is referred to genetic counseling if they doubt a genetic condition or if any individual is already diagnosed with a genetic condition. First is the pre-test genetic counseling session, during which the counselor collects complete details of the counselee, which will be the complete family history, if there are any marriages between relatives, personal medical history, and other details like the person's lifestyle, ethnicity, habits, etc.
How are all these details or information going to be of use to the genetic counselor? Because some of these could be sensitive information or something that is confidential.
All of these details that are collected will help the counselor understand if there is any genetic condition that runs in that family. If an individual is already clinically diagnosed with the condition, the counselor assesses the presentations in the individual, like the physical appearance or the health issues he or she is facing. Now, based on the details collected, the counselee is explained about what might be the issue, if this could be hereditary or runs in their family, and what sort of genetic testing they could opt for to get a clear diagnosis. All the information collected is strictly confidential, and a genetic counselor has to make sure that none of the patient's information goes out of the clinic or the organization.
So now, an individual has opted for a test based on your genetic counseling session. So what happens after the reports are out?
The post-test genetic counseling session is what is conducted once we have the reports. In this session, basically the counselor explains the report outcomes to the counselee. Based on the results that are there, they are explained what the future risks might be, what they would have to do to manage their risks in the future, if their family members can be affected, and if the condition will be passed on to their future generations. Based on the risks associated, management plans are suggested, suitable follow-ups and therapies by other medical professionals are advised.
So not just the patient, but also the parents, siblings, and future generations can be told about their risk.
Yes, so if it is a hereditary condition, close family members like siblings, parents are also suggested genetic testing. The counselee is also informed if their children could be at a risk of getting the same condition, and they are provided with options of testing during the pregnancy or after the child is born. Again, all the information is provided to the individuals or the family, but it is completely up to them if they want to go ahead with whatever is suggested.
So now that we know about what genetic counseling is and what the entire process is, can you let us all know who should consider genetic counseling?
Any individual who has a strong family history of medical conditions, or if any individual is diagnosed with any medical issues which is suspected to be genetic, or if a couple has married within the family, like if two blood relatives are married and are planning on having children, or if it is an individual who is born to parents who are blood relatives. Also, if a couple has been having repeated pregnancy losses, or if a couple or husband or wife are above the age of 35 and are planning a pregnancy. In all these cases, it is suggested that they seek genetic counseling.
Now that we have understood all that we need about genetic counseling, let us discuss the relevance of genetic counseling in cancer. Why is genetic counseling and genetic testing important for cancer patients?
A lot of people may not be aware about this, but cancer is a genetic disorder. It happens because of the errors in the DNA. Most cancers that are seen are caused because of somatic changes or mutations, which means that it is a change that occurred over the course of one's life after they were born. When the cancer is due to a somatic mutation, it will not be passed on to the future generations, so there won't be a risk of cancers running in the family. The reason for somatic cancers could be lifestyle factors, harmful chemicals, pollutions, or food that is consumed, or maybe other reasons. But then, 5 to 10% of the cancers are because of inherited changes, which means that this will be passed down to the future generations and the family will be at a risk for hereditary cancers. So, for people who have a strong family history of cancers and are not diagnosed yet, or for individuals who have been diagnosed with cancers at a younger age or have multiple primary cancers, genetic counseling and testing is important to see if there are future risks of hereditary cancer for the counselee and their family members. Genetic testing for cancer patients can also help clinicians or doctors decide advanced personalized treatment for the patient.
So would you say individuals or families with such family histories or who want to find out about the risk of hereditary cancers have to consult a genetic counselor before taking the decision?
Yes, Gayatri. Anybody wanting to understand about the risks for hereditary cancers or who are wanting to go for a hereditary screening for cancers should definitely consult a genetic counselor before making a decision.
Thank you, Vaishnavi, for always being so prompt and clear with your answers. It was truly an insightful talk with you. And to our listeners, thank you for tuning in to the Oncobuddy podcast. Be sure to subscribe for more informative episodes. To stay more connected with genetic counselor Vaishnavi, download the app from Google Play Store. In Oncobuddy, we have different sections for patients. We have Onco Hub to get answers to all your questions and concerns from clinical experts. Onco PHR is your personal health record manager to manage your medical records digitally very easily. Onco Consult for virtual consultation with treating oncologist, dietitian and psychologist. Do download our app to explore more. Until next time, take care and stay healthy. Together we beat cancer.